Somewhere between the beaches everyone talks about and the theme parks everyone visits, there's a Florida town built on horse farms instead of hotels. No coastline, no boardwalk, just rolling pasture, oak canopy, and a cost of living that quietly outperforms almost every headline retirement destination in the state. Before the location, the promise, no travel footage, no this town is charming filler. Just a real $900 monthly retirement income run against every real expense this town actually charges, ending in a single number, a score out of 100 that says whether the math works or not. This is Ocala, Florida, and the question on the table is simple. Does it hold up? The location Ocala sits in north-central Florida, roughly equidistant from Tampa and Jacksonville. In Marion County, an area better known nationally for thoroughbred horse farms than retirement communities, even though it sits 15 miles from the Villages, the largest age-restricted retirement community on the planet. There's no Gulf breeze here and no beach chair 15 minutes from the front door. What there is instead, a median home value hovering around $270,000 to $280,000, a cost of living that lands close to the national average overall, but a striking 19% below Florida's own statewide average. That gap between average nationally and cheap for Florida is the first real signal that this town might be doing something different than its coastal cousins. The baseline scenario every episode of this series runs the same fixed scenario, so numbers stay comparable episode to episode. This is a single retiree, age 62 or older, living on $1,900 a month in fixed income, Social Security or a modest pension, with $100,000 in savings held in reserve, not touched unless the monthly budget runs a deficit. This is a renter's scenario, not a homeowner's, which matters because owning versus renting changes almost every line item that follows. A homeowner's numbers will differ, and if there's demand for that version, it gets its own episode later in this series. Housing rent is where Ocala starts to separate itself from the rest of the state. Housing costs here run roughly 21 to 22% below the national average, and a modest one-bedroom apartment suitable for a single retiree averages around $950 a month, a meaningful gap below the $1,200 to $1,400 range, quoted for slightly larger or newer units in town. This is the category doing the most work in this budget, and it's the category most directly responsible for whatever score Ocala ends up with, taxes Florida. Charges no state income tax and no tax on Social Security or retirement account. Withdrawals, the headline fact everyone already knows. What gets missed is that a renter doesn't pay property tax directly, though it's baked quietly into the rent a landlord charges. For anyone considering ownership instead, Marion County's property tax rates rank among the lowest in Florida, and the state's homestead exemption knocks up to $50,000 off a home's taxable value for a primary residence. With annual assessment increases capped at 3% under the Save Our Homes provision. None of that applies directly to this episode's renter scenario, but it matters enormously for anyone doing the same math as a buyer. Insurance Florida carries the highest homeowners insurance costs in the entire country, averaging $700 to $8,300 a year statewide, a number driven almost entirely by coastal hurricane exposure. Ocala's advantage here is geography. It sits well inland, away from direct storm surge risk, which tends to soften that number considerably compared to coastal cities, though it doesn't eliminate storm risk from wind and rain entirely. For this episode's renter, homeowners insurance isn't the relevant line item anyway. Renter's insurance is, and it runs a fraction of that cost, typically $15 to $25 a month. Add a modest auto insurance policy, and the full insurance line for this budget lands around $110 a month. Healthcare. This is the category every retiree over 60 watches most closely, and it's worth being precise rather than vague. The standard Medicare Part B premium for 2026 is $202.90 a month, up from $185 in 2025, a nearly 10% jump that caught a lot of retirees off guard this year. Layer in a modest Part D prescription drug plan and typical out-of-pocket costs, And a realistic monthly health care line for this budget lands around $250. Advent Health Ocala provides solid regional hospital access, though this is a number that shifts significantly based on individual health status, prescriptions, and whether someone carries a Medicare Advantage plan versus traditional Medicare with a supplement, worth stating plainly, because averages hide a lot of individual variation here. Groceries, utilities, and transportation grocery costs in Ocala run close to 20% below the national average, landing around $320 a month for a single person eating reasonably, not lavishly. Utilities, electricity, water, and the air conditioning bill that never really goes away in Florida average around $150 a month. Transportation, assuming a paid-off vehicle with no car payment, covers fuel, maintenance, and registration at roughly $140 a month. The real monthly budget added all together against that $1,900 monthly income. And here's where Ocala actually lands. Income, $1,900. Housing, $950. Insurance, $110. Healthcare, $250. Groceries, $320. Utilities, $150. Transportation, $140. Total expenses, $1,920. That leaves a monthly shortfall of $20. Not a crisis, not a windfall. Essentially a rounding error against a $1,900 income. Drawing that $20 gap from the $100,000 reserve fund means the savings would technically stretch for centuries at that rate, which is really just another way of saying the monthly budget effectively balances on its own, with the reserve fund staying almost entirely untouched under normal circumstances. This isn't the dramatic "your money will last exactly 4 years" story some retirement content likes to manufacture. It's the quieter, more honest story. A budget that essentially works, with almost no margin for the unexpected. A single bad health care year, a major car repair, an insurance premium hike, and that thin $20 cushion disappears fast. The retirement ledger. Score housing 18 out of 20. Genuinely one of the strongest housing values in the state for this income level. Taxes, 14 out of 15. No income tax. And even without factoring homeowner-specific breaks, this remains one of the most tax-friendly setups available to a retiree anywhere in the country. Insurance, 13 out of 15. Inland location keeps this well below Florida's brutal coastal averages, though Florida's overall insurance market volatility keeps it from a perfect score. Healthcare, 11 out of 15. Solid regional access through Advent Health Ocala, docked slightly for a healthcare line that leaves limited room for anything beyond standard. Medicare coverage, groceries, 8 out of 10. Meaningfully below national average. Transportation, 7 out of 10. Reasonable, unremarkable, no major advantage or drawback. Safety, 3 out of 5. An average small city safety profile, neither a standout advantage nor a serious concern lifestyle. 8 out of 10. Proximity to. The villages bring social infrastructure and amenities within reach without requiring residents to live inside an age-restricted community themselves. Total retirement ledger. Score, 82 out of 100. The final verdict, Ocala, earns a genuinely strong score, and the reasoning matters more than the number itself. This works best for a retiree who prioritizes low fixed costs over beach access, who's comfortable renting rather than owning, and who understands that an essentially break-even budget means very little room for financial surprises. It's a considerably weaker fit for anyone expecting coastal living, and the thin monthly margin means this isn't the town for someone without at least some cushion beyond the baseline $100,000 reserve. One clarification worth repeating: every figure here is a modeled average based on 2026 cost of living data. Medicare's published 2026 premium rates and regional real estate reporting, not a personal quote. Individual health care costs, insurance premiums, and rent will vary based on specific circumstances, prescriptions, driving history, and the exact unit or lease terms involved. This is a framework for thinking clearly about a decision, not a substitute for running the exact numbers on a specific address, plan, or policy before committing to a move. There's a version of this story that plays out constantly across Marion County, and it rarely looks dramatic. A retiree relocating from a high-tax northern state, New Jersey, Illinois. New York, she arrives having already run rough numbers in their head. No more state income tax, no more punishing property tax bill, a mortgage or rent payment that suddenly looks almost quaint compared to what they left behind. What they don't always expect is how thin that margin actually is once every category gets counted honestly, including the ones northern budgets never had to think about. A homeowners or renters insurance market shaped entirely by hurricane risk. A Medicare premium that just jumped nearly 10% in a single year. An air conditioning bill that runs 12 months instead of 3. The savings are real. They're just smaller and tighter than the marketing suggests. That's precisely why this series exists. Not to promise paradise and not to manufacture panic, just to run the actual math once clearly, before a decision that's difficult to reverse gets made based on a feeling instead of a number. Next episode, the same 1/1900 budget goes up against a very different kind of Florida town, and the score won't be nearly as forgiving.